Hello there, and happy Wednesday. I am going to be joined by Katherine here. So invite her, and yay, she already is going to join. I think you just got the invite. Yes, look at how fast that was. Record time. And
Hello.
there you are with all your brains and neurons in the background. I love it. I love it. Well, a
Oh,
happy Wednesday, Katherine. It's
happy
great to
Wednesday to
see
you,
you.
Julie, and thanks for
Yeah.
joining us, guys.
Yeah, we got a whole crew on already. I think because we were going to be talking about dizziness, so always a hot topic. But I'm not sure if everybody knows you, Katherine. Hey, Brian says hello, hi. And so I want you to introduce yourself,
Yeah.
a little bit about you and your story, and also just your background in dizziness.
Okay. So I am Katherine Deines, a neuro and vestibular physical therapist in Denver, Colorado. Been practicing since 2001. So our class was called Physical Therapy Odyssey, like 2001 Space Odyssey. Dating myself there. And pretty quickly into my career, I started going down the vestibular path. I was the person in school who loved everything. Did our peds unit, like that's what I was going to do. Did orthopedics and clinicals, and like everything I did, like that's where I'm going. But my first job was at a community hospital in Monterey, in the central coast of California, and it was a fantastic job. And the person who was doing all the vestibular stuff was going out on maternity leave. And so we kind of needed somebody to step in, and we're at a staff meeting, and I just found myself like raising my hand, like, I want to do this. And it wasn't anything I had like planned or really thought through. It just kind of spontaneously happened. And that was like a handful of months into working. Um, and so I had an excellent mentor, and she taught me like the basics with BPPV and testing. And of course, my very first patient without her was a horizontal canal, BPP. What are the chances? So I was calling her like, I know you're with your baby, but I really am not sure what I'm doing here. I think I've got this barbecue roll thing down, but what's going on? And then shortly after, did the Emory course, which was a huge, like multiple days crash course. And really just been practicing vestibular since the get-go. So after a handful of years in California, my husband Eric and I moved to Colorado, where he's from. He's also PT, so we met in PT school. And I started working at an outpatient neurovestibular clinic, and that's where I met Jaimy. So that was in 2004. And really, like, that was just such a great immersive experience. And working with some excellent therapists who were mentors. Kenda Fuller, who's like the pathology book, was one of the owners. And so I got to learn a lot from her for many years while I was there, which was an incredible experience. And Jaimy and I studied together for our NCS and took that test back in 2007. And it wasn't then, gosh, it was another 3 years after that my husband Eric and I started our own practice together. So mobile practice, primarily seeing seniors, but it's really grown to be kind of everything now. So we're a practice now of 6 therapists, and one is Claire Cronenweth, who did the Schmidt's Fellowship Disorder with re+active, and Julie completely hooked us up with Claire, which has been a fantastic addition to our team. So yeah, we are just kind of all over the Denver metro area treating orthopedic issues, dizziness, FND, all things neuro, and that's kind of our story. And then when I'm not a PT and running the business, I've got 2 boys who are 15 and 11, and they're wrapping up the school year, and we're just gonna be full on in baseball. So that's me in a nutshell.
I love seeing all of your mom things too. And so Katherine and I were so lucky to meet and be, a part. Now I feel like we're family, but be a part of
For
our
sure.
Brain Bytes community is really where we connected the most with Katherine and Jaimy. We keep talking about this Jaimy, and she's not here,
Yeah.
but Jaimy's another neuro PT and vestibular therapist who is part of our community, and Jaimy and Katherine together are teaching an upcoming course for us, which is the Positive Spin on Dizziness 2.0, Volume 2, is coming out this August, and we've been talking about it a lot because you just hosted that amazing vestibular migraine webinar, which was so good, by the way. We hosted that last week, so we've been talking about vestibular. You got me all kind of excited about my vestibular stuff. We've been sharing some of the stories from here at Reactive, where you honestly have influenced so much of what we do and so much of what so many therapists have done. And you got to just talk briefly, because you did a podcast recently too, talking about optical flow. And I was just like, yes, the whole world has, I don't know if you don't mind commenting on some of the things that you shared in that podcast.
Yeah, so we were fortunate. Erica DeMarche is the owner of Step and Connect and has a Balance Matters podcast. And she and Jaimy really worked together more. I was on my way out on maternity leave with my second kiddo and starting my business, and Erica was taking over a lot of my caseload. So Erica is also a neuro and vestibular therapist and really has a special interest in balance, and so has her own podcast where she's interviewed a lot of people that we're all connected with at our old clinic. And so she and Jaimy had just got out to lunch, and we're talking about all the things that Jaimy and I have been focusing on with optic flow and visual motion hypersensitivity. And as they were talking, Erica goes, we got to have you guys on our podcast. So we had so much fun. It was just like old friends chatting on Zoom about all things visual dizziness and the concept of optic flow, which is just this constant movement around us as we're moving through space, or movement of a busy visual environment like watching a kiddo's soccer game or volleyball, that sensation you get driving in the car, things going past you, or walking down the aisle of the grocery store. That's all optic flow. And we just discussed a lot about the grades of challenge that come with that, and where do we start a person who has visual motion hypersensitivity? How do we know how much is too much or not enough? And that was really, an hour went by very quickly just discussing those things. That's a lot of what we are going to dive into in the Positive Spin on Dizziness Volume 2. So we have a whole section just on visual motion hypersensitivities. We touched on it some in the first course, but realized it's such a big topic and so confusing at times that it really needs more attention. So that was one of the things. Very quickly after we wrapped up Volume 1, Jaimy and I were like, okay, what do we do differently? What else do we need to include? What do we need to expand on for the next course? Which we hadn't even discussed doing a next one with you guys, but we were like, okay, where are we going with this? And visual motion hypersensitivity was definitely something we knew, like we want to cover this in more depth for sure.
Yeah, and boy, am I so glad. And boy, are so many of our patients so glad that this is something that we're diving deeper into. I personally feel like before I met you and Jaimy and before Positive Spin 1, I just kind of had like a surface level, and I intuitively like saw things for like optic flow and responded to patients, but didn't really have the full picture. So I was so appreciative in Positive Spin 1. And I know like our whole clinic was just like, that was life-changing for us. We can't wait for Positive Spin 2. And now it's here. So I wonder if you could talk a little bit about how you're setting up Positive Spin 2, kind of like what's included for people. And I'll remind people too, Positive Spin 2 is in August, but we do an early bird, as we always do, and it's only through tomorrow at midnight. So I just wanted to remind people that get on board, save money, and get this great one-day course. But yeah, Katherine, walk us through a little bit kind of what we're going to see in the course.
Yeah, so we, from Positive Spin 1, we spent a lot of time into this framework of understanding a sensory dysfunction from a sensory hypersensitivity. So we didn't discuss diagnosis so much as just understanding impairments. So regardless of the diagnosis, this is the approach we could take with any person with dizziness. And how do we start to break down what do we have to do in order to most effectively address their dizziness? So we're taking that framework and applying it really to three big diagnoses of vestibular migraine, Meniere's disease, and mal de debarbement, which have really hypersensitivity and altered functional connectivity, driving a lot of the chronic symptoms with those diagnoses. So we're going to spend it comes out to almost like 2 hours per chunk to discuss and dive into what are the mechanisms behind these different diagnoses, what's the diagnostic criteria, so how do I tease out what's what, because there's a lot of overlap, and just kind of understanding the differential diagnosis of these, and then getting into what are our options for treatment. So there's just so much in the literature coming out right now. I get my little Google Scholar alerts like multiple times a day. Like, oh, I gotta stop. And Jaimy and I joke about we need to stop reading because we just need to start putting things down. And but then we go down these rabbit holes like, oh my gosh, I just found this most amazing article.
Oh, the struggle is real. I feel you.
Yes.
I feel you.
So we're focusing and rating it in, but I know there's gonna be so many more amazing things that get published between now and August 20th. So 20th, August 20th. I'm trying to figure out the date.
Yeah, that's right.
Yes, so that's really, we're going to focus on those three big diagnoses that are really challenging and often fluctuating, right? A person can look one way one day and be a totally different person the next time we see them. So just trying to figure out how do we give them strategies for when they can have these wide swings in their function and their symptoms. How do we make sure that we're not pushing them too much too fast, and especially with vestibular migraine. And I think there are studies that show vestibular rehab's not always super effective, but I think that it's often that we aren't specifically making a program for that one patient, right? And it's hard in a study, you're trying to standardize everything so everyone gets the same program. But for a person whose primary problem is that they have this hypersensitivity, we can't say every day you're going to do X, Y, Z, no matter what, the exact same amount. And so, yes, we see, I think that turns away a lot of people because they have a bad experience with rehab. It was way too much and it triggered their symptoms, and then they stayed symptomatic for days afterwards. Who's going to want to go back to therapy after that? So that's
where I
think
worse, right?
that they got worse, right? And so it's understanding how do we grade their program so that we're pushing it a little without getting them way over the edge, way beyond what their inner ear and their brain is capable of handling at that moment, so that we're really pushing them to get better without just completely overwhelming.
Yeah, that's great. Yeah, I mean, you just dropped so many dizziness knowledge bombs right there already, Katherine, that I think are going to help people. And I know, even if we have some people who experience chronic dizziness here, and maybe you've had a bad experience where it's it doesn't work. It just made me worse. Do you hear Katherine's word? Well, maybe you didn't get quite the right thing, right? And the right dose of it, and the right activity with it, particularly when it comes to optic flow. And so if you're a therapist out there that also has felt a little oh, people are getting worse and not better, this is what you need. I'm telling you because this is what I needed. But this is so helpful for those. Now, this is not the Emory vestibular certification course. This is not how to treat BPPV. This is truly for those complex dizziness cases, the fluctuating dizziness, the ones that don't respond to your kind of typical vestibular therapy. And this is the type of course that it just doesn't exist. I know I've been to little lectures at CSM on mal de debarbement or migraine or Meniere's, but bringing it all together and starting to show some of the overlapping pieces that are similar and different, and helping us tease out not everything's 3PD, right? Not everything's one thing, and teasing that out very specifically, I think makes such a difference for patients, right? And that's why we're all here. We're here trying to help people and not get them worse. And I think that's the ultimate that I see from this course is outcomes are changed, right? And I'm sure that's, this is something you've developed from your clinical practice.
Right,
You
right.
you you probably, like me, got people worse sometimes.
Oh, 100%. Yes. And we talk about that, like, sorry, patients from 15, 20 years ago. I wish I could go back and not that they didn't get positive things out of what we were doing, but it would be so much different now, right? If they walked in today. But a lot of what Jaimy and I have developed has been from years of what didn't work, right? And just a lot of us discussing back and forth. Jaimy is brilliant. I am so fortunate to have her as a teaching partner, and for the years, while we were working together, and then after both starting our own practices, just being able to call each other up and bounce ideas off one another. And so this is really just a culmination of all these years of conversations, and both loving diving into the literature. And we're just so fortunate there's so much more available now in our understanding with functional MRIs and understanding the mechanisms behind these complex dizziness diagnoses. And really, when I was first learning all things vestibular, what I learned about Meniere's disease or vestibular migraine was like a 30-minute talk on medication management, and then a whole lot on how to Hall pike and do horizontal roll tests, but not everybody's BPPV. And in fact, I was just reading an interesting article that in the total population, vestibular migraine is actually more common than BPPV. It's just way underdiagnosed, and it doesn't, people aren't shuffled to physical therapy either because the physician goes, it doesn't work, or there's just not enough. And there's getting to be more and more. It's just hard to do like a good randomized controlled trial with vestibular migraine, and BPPV can be very like clear cut. Here's 200
Right.
people with posterior canal, right? Vestibular migraine can look so different. Meniere's disease can look so different. And mal de debarquement, it's very hard to figure out, like, let's get a whole group of people who look the exact same with these diagnoses, because they just don't. So we know with the right kinds of therapy, vestibular rehab is a huge component to getting these folks better. It just has to be done the right way, and understanding that how do we start them and how do we progress them.
Yeah. Oh, you hit the nail on the head. And I think that's the fun of it, like, because this is so interesting and fun and challenging all at the same time, because no two people are alike. So that's why, I mean, I love BPPV, right? I love testing and treating it. But it's like a slam dunk often compared to some of these other disorders. Now, of course, there's lots of variations in BPPV too, but not quite to the effect of some of the more chronic and fluctuating dizziness that we see. So I think that's where having the framework that you put together for this course to guide an individualized process, right? Like, it's not a cookbook. It's really a framework, a structure, a little guide for us to help problem solve together with people.
Absolutely. Yes.
And I'm so excited for it. So I'll remind people. So again, we're talking about Positive Spin Volume 2 that we just released. It is live August 20th. It's a one-day online course. One of these days we're going to do it in person, but oh my gosh, COVID again is crazy here in California. So I'm glad we're not doing it in person. It's online. It's a day long, and it's early bird rate through tomorrow, which is Thursday. Now, I do want to let people know, like, a major thing that we decided today, and I'm really kind of like sad and bummed about it, but it was something that we logistically just had to make a decision. When we opened up this course, we were really excited to open up a mentoring community with Katherine and Jaimy. And this was very purposeful because people asked for it. And Jaimy and Katherine are amazing mentors already in our Brain Bites community, and just with fellow therapists and talking about the complex dizziness. Unfortunately, the community for Positive Spin is not going to work at the moment. So we're kind of pulling back that offer. so you'll actually see in our emails that go out tonight or tomorrow, if you're on our newsletter, that the community is no longer available. And we're letting people know. We did have people very interested in it, and we're letting them know to be continued, because we do have an amazing community that Jaimy and Katherine are part of. They've done some really great things in our Brain Bites group already. And so this is very likely when we open up our doors to Brain Bites again, be prepared to hear about our dizziness track. But it just wasn't in the cards for us to do it right now. So if you were waiting on that community, join us for the course. It's fantastic. And then we're going to be opening up our doors to our Brain Bites communities very soon after that. So hold tight, be patient. And thanks for being patient with us needing to change things too. Sometimes life happens and other things happen, and we just have to pull back a little bit. So that's what we're doing. We're pulling back. I never pull back. So this is really hard for me. So I'm just putting it out there. I'm not one to pull back.
Yes.
As probably most people know, I'm loyal to the bone, and I'm going to do it and stick with it. And this was just, life really has hit very hard this week. And was one of those things. So we're bummed about that part, but it does open up the doors. Come join the course. The course is on August 20th. And it's a full day, right? Like I think it's 8 to 5, right?
Yep.
Katherine?
Full day.
Full
Absolutely.
day, and covering those topics you didn't get in school. You're not really going to find anywhere else in a course together with a framework that's going to really help you get those outcomes. And also, Katherine, this is what, how my practice has changed. So I'll just be a walking billboard for you. It's get there quicker. Like, I might have gotten there and it took me months to get there. But I think with the framework, I know with the framework that you've presented and shared, it really helped me hone in and get there like day one, where it's just like, holy cow, I can help this person right here, right now, and know how to progress them. That's a game changer in therapy practice, if you can help people like that. And I just want to come and be a fly on the wall in your practice, because I just feel like, your patients are so lucky to work with you. Jaimy too. So,
and that's really our goal, is helping the therapist to understand more efficiently what's going on with that patient, so that you can really effectively help them faster, reach their goals more quickly. And I think that's right. We can muddle our way there, but we're trying to help unmuddy the water, so it's very clear what to do early on with these patients.
Yes, unmuddy the waters. I love it. I love it. Well, Katherine, thank you so much for sharing your knowledge. I think a lot of people will even walk away from this video going, oh yeah, wow, I'm going to look at things differently. So, again, Positive Spin 2.0, there's a link in our bio, but it's also reactiveeducation.com, PS2, not PlayStation 2, which I still have one of those at my house, but PS2, reactiveeducation.com, PS2. And through tomorrow, which is Thursday, midnight, you can get the early bird rate. It saves you a ton. And if you've got questions, for us, for Katherine, shoot us a message. We're happy to answer those as well. And otherwise, we'll see you in the course.
Thank you so much, Katherine. It was great to chat with you, and we look forward to seeing everybody in August.
Yes, thank you.
Thank you. Have a good night.
Bye.